Good afternoon. Welcome to the City of Toronto COVID-19 media briefing for Wednesday, May 20th, 2020. Joining us today, Dr. Eileen, Toronto's Medical Officer of Health, Toronto Mayor John Tory, and Toronto Fire Chief and General Manager of the Emergency Operations Centre, Matthew Pegg. First today is Dr. Davila. Doctor?
Thank you, Brad, and good afternoon. Today, there are 263 new COVID-19 infections in Toronto. To date, 6,735 have recovered, an increase of 119 since yesterday. For more detailed data on the status of COVID-19 cases in our city, please visit our website. I would like to take a moment to address the recent increases in our local COVID-19 cases. My team reviewed our data and confirmed that there was an increase in the volume of lab tests we received over the past 2 days. Of note, there was an increase in our daily COVID-19 case counts in long-term care homes associated with increased testing that was being done in these settings to detect the virus sooner. Further analysis of these data gives us a better picture of our local situation and shows that our community cases are still continuing to slowly decline. Overall, this news is promising because we can isolate those who are ill faster, prevent further spread, and continue to move forward. On another topic, I continue to receive many questions on whether or not face masks and face coverings protect people against COVID-19. I also continue to get asked if they are mandatory and if people must wear them in grocery stores, on public transit, or outside when they are exercising. I'm therefore taking some time today to address these questions directly. First, we know that COVID-19 continues to spread in our city. This is why I continue to remind you to keep 6 feet or 2 meters away from others when not at home, to avoid touching your face, mouth, nose, or eyes, and to wash your hands often. These are the best ways to protect yourself from the virus. According to the Public Health Agency of Canada, wearing a face covering or a cloth mask in the community has not been proven to protect the person wearing it and is not a substitute for physical distancing and hand washing. It is important to note that while the available scientific evidence on this subject is limited, there appears to be some benefit to wearing a mask in that it protects others from your germs. This is why, at this time, I echo the recommendations shared earlier today by my provincial and federal health colleagues, and I also strongly recommend wearing a mask in settings where you cannot physically distance from others. As I have shared many times, COVID-19 is a new virus, only identified in January. The reality is that we are still learning about this virus. We have learned that COVID-19 can spread before someone has symptoms or is even aware that they have the infection. This is why, especially now as we approach reopening in our city, I strongly recommend that we use face masks to protect others when we are in settings where we cannot maintain physical distancing. This will help to reduce virus spread in our community. Some examples of when to wear a face mask to protect others include when you are in an elevator, when you are grocery shopping, using transit, a taxi, or a ride-share service. If you are out walking on the street with plenty of space, you do not need to wear a mask or a face covering. If you are out for a run or a jog, you do not need to wear a mask or a face covering. However, when you are out and about, you may find yourself in a situation where you may need a mask when you cannot maintain 6 feet of physical distance from others. So I ask that you please plan ahead as best you can. At this time, face masks or face coverings are not mandatory in Toronto. Another common question that I continue to receive is about what kinds of masks are most effective and what would I recommend. According to the Public Health Agency of Canada, face masks or face coverings should allow for easy breathing, fit securely to the head with ties or ear loops, maintain their shape after washing and drying, include at least 2 layers of tightly woven cotton or linen, and cover your nose and mouth without gaping. And if you wear a mask, please be sure that you are putting it on correctly. The first step is to wash your hands with soap and water, or use an alcohol-based sanitizer if soap and water are not available. Keep your hair away from your face and place the mask over your mouth and nose snugly to ensure that there is no space. Your mask should fit comfortably and you should be able to breathe easily. It is important that you do not share your mask with others and that you do not leave it around your neck, hanging from your ear, or on your forehead. This could increase the chance of the mask becoming contaminated. Many local businesses are selling cloth face masks. For those of you who wish to make your own, please review the instructions on the Government of Canada's website. You can find the link on the City of Toronto website. A used mask should be placed directly in the laundry or a lined bin to be cleaned. Cloth masks should be washed after each use in the laundry with other items using the hot cycle. Non-reusable masks should be discarded in a lined garbage bin after use. I would like to remind everyone, it is extremely important that we keep the supply of medical masks for healthcare workers who need them for medical procedures and to care for individuals who have COVID-19. I ask you to consider making your own mask or purchasing one from a local retailer or online. My final point about masks is that not everyone should wear one. This includes children under the age of 2, anyone who has a medical condition that makes wearing a mask difficult, or who cannot remove the mask without assistance. On another topic, I continue to receive many questions about public health's role with COVID-19 testing. First, I want to clarify that the province leads all COVID-19 testing and testing guidelines in the province of Ontario. Local public health departments can recommend for an individual to be tested, and we follow up with anyone who is tested positive for COVID-19. However, we do not conduct the tests. Community COVID-19 testing in Toronto is done almost exclusively by local hospitals and assessment centres. COVID-19 symptoms and a complete list of local assessment centers is available on our website. I have also received many questions about whether or not people should get retested after they have had the virus. Most people can be considered no longer contagious 14 days after their COVID-19 symptoms started, as long as their symptoms are getting better. At this time, the only people who need to be retested to confirm that they are negative for the virus are people who were hospitalized with a severe COVID-19 infection and are waiting to return back to long-term care homes or to a shelter. In addition, some healthcare workers are required by their Occupational Health and Safety Service to be retested in order for them to return to work. In closing, we need to continue to be very careful as we move forward, so we don't find ourselves in a position where we have to go back. So please, continue to practice physical distancing, and please continue to take care of each other. I'll now hand it over to Mayor Tory for his remarks.
Well, thank you, Dr. Davila, and I want to begin by thanking Dr. Davila, as she's done on every major question throughout this pandemic and this emergency, for providing clear advice to the people of Toronto on the matter of face coverings. This has been probably the most often asked question from Torontonians, especially as we begin to reopen and to circulate more through the city. The strong recommendation from Dr. Davila, concurred in by her provincial and federal counterparts, is simple: wear a face covering when in doubt. We have the best public health professionals in the world to give us advice on this, and they're having done so. As Mayor, I accept that advice and reinforce the importance of paying attention to it. So that means if you are taking public transit, please wear a face covering. If you're taking a taxi or a rideshare vehicle, please wear a face covering. If you're going into a store, wear a face covering. In short, if you are in any situation outside of your home where you may not be able to keep your distance of 2 meters or 6 feet from others, please wear a face covering. As Dr. Davila has explained, a non-medical mask or scarf won't protect you from getting COVID-19 necessarily, but it will help you to stop from spreading your germs to others. So if we're all wearing an appropriate face covering when we're out in public, we are all working to protect each other. This is the best advice we have from our public health experts right now, and it will help us move forward with the restart and economic recovery and the task of minimizing a return to a broader spread of this still very deadly virus. There's been some coverage lately that men in particular don't want to wear masks or face coverings for a variety of reasons, but including one that says that they see it somehow as a sign of weakness. Nothing could be further from the truth. By covering your face, you are making sure you do everything possible that you can do to protect your family, your friends, your neighbors, and your fellow Torontonians. You are helping stop the spread of COVID-19 and making sure that our healthcare system remains strong. This is a sign of strength, not a sign of weakness. The City of Toronto will be leading by example on this issue. While we already provide surgical masks and other pieces of personal protective equipment to employees who require it to do their jobs, we will also be encouraging our employees to wear face coverings when in situations where it is advisable, where they can't keep their distance, whereas it is advisable based on the advice of our public health professionals. For example, when they are not on the job, but they are coming to the job on public transit and may be concerned about that, we want to make sure that we make it easy for them to do what has been advised, which is to wear a face covering. To assist them in doing that, today, we are beginning the process to secure over 100,000 reusable cloth masks to provide to our employees. Employees will be encouraged to use these face coverings in their daily activities, including while riding on public transit, as so many of them do. Until the ordered masks arrive in 4 to 6 weeks, our staff, like other members of the community, will be encouraged to continue to use their own facial coverings when they are in situations where it is not possible to maintain physical distancing. This is one more way we are protecting the interests of people who work in the City of Toronto. In this case, they work for us, and that we are working to prepare for a restart and recovery and help address the fear and the anxiety that I know many are feeling right now. Now, having taken that leadership to protect our employees and help them to protect others, I am asking all employers to step forward and similarly advise their employees about the wearing of face coverings, and also I am asking those employers to supply non-surgical masks to their employees. I think that would be the right thing to do. I want to thank our park staff who worked quickly yesterday once we received the provincial order to reopen the more than 70 off-leash dog areas in the city. After consulting with public health officials, park staff are also reopening BMX, frisbee golf, and disc golf and skateboard parks right now. Many parking lots are also being reopened this week. Again, we're taking into account crowding concerns and public health considerations. Waterfront parking lots will likely remain closed for the time being, and High Park will continue to be closed to automobile traffic on weekends. I'm pleased to announce that this weekend, the following parks amenities will be open. Basketball courts, and just to give you an example, we have 150 of those across the city, picnic shelters, outdoor sport facilities and multi-use fields, baseball diamonds, of which we have 300 across the city, soccer fields. Park staff have also started preparing tennis. We have 600 courts in 185 locations, platform tennis, pickleball courts, and all of those will begin to open this weekend. And they will be subject, as all of these sports facilities will be, to quite specific physical distancing rules. I mention the numbers because I want you to have some ideas to the undertaking that this involves for us to have all of these locations and facilities appropriately signed and to make sure that they're safe and healthy for the people of Toronto, and as a further indication of some of the differences that exist between the City of Toronto and other municipalities and communities in the province in terms of the scale of the things we have to prepare and get ready once we learn, often late in the piece, about things that can be open or can't be open. All of these will be open subject to conditions consistent with provincial rules on who can or cannot use these facilities at this stage, and continuing provincial restrictions on the size of groups which can gather at these facilities. While the fields and courts will be open, permits remain cancelled, and the provincial and city orders on physical distancing in parks remain in effect. We are relying on people to be personally responsible and to continue to keep their distance from others, even in the parks. And I think Dr. Davila very well explained why this is, because we don't want to go back. We want to keep making progress and make sure we don't go back to a time when we're spreading this virus, often unknowingly. These facilities, therefore, are open for casual use rather than for team sports in that same spirit. If you arrive at an amenity in a park that is crowded, you should wait until there is enough space for physical distancing or return at another time. Again, it is a matter of common sense and personal responsibility. The reopening of parks amenities will continue into next week, with park staff working with Toronto Public Health to prepare, for example, to open lawn bowling facilities and outdoor bocce. As you know, Phase 1 of the reopening started this week with shops with street entrances being able to open their doors, in addition to a number of these amenities that I've just been discussing. Day 1 of that process, namely yesterday, went well, with the city receiving 0 complaints about businesses. This is an indication that businesses who are ready to reopen, and both the Premier and myself urged businesses who were not ready to open not to open, and it appears a number took that advice or were prepared to do that on their very own. But those that did reopen are doing the right thing and following the public health guidelines in order to keep their employees and their customers healthy and safe. Residents are also continuing to do the right thing. They're keeping their distance from others and not rushing out en masse to make non-essential purchases. This will be a slow and steady restart, and I want to thank everyone for their ongoing cooperation, as the vast majority of people have been doing throughout this crisis. We will be monitoring this continuously and won't hesitate to take whatever steps are necessary if we find that there is any kind of a threat to public health or a threat that we will be going backwards as this endeavor unfolds. We're getting through the emergency because so many people are dedicated to doing the right thing and to following the doctor's orders. It will take time, and we will follow it very closely, and we want to avoid having to go back, just as we want to avoid backsliding on the state of public health itself. I know people just want to safely get back to normal. I do too. But the best way to do that is to keep taking precautions, and yes, wear a face covering in situations where you're concerned about your ability to maintain physical distancing. I would now like to invite Chief Pegg to provide an update on the work our Emergency Operations Centre is doing and to highlight the planned major road closures this weekend in order to continue to expand ActiveTO. I'm proud to announce that we are expanding the ActiveTO major road closures this weekend. I will say that I had a briefing from our staff today to review what happened last weekend, and the roads we found, of course, from what we saw on television, what I saw myself. I visited both the east and the west ends of the roads that were closed down by the lakeshore and near Bayview, and found that literally thousands of runners and walkers and cyclists of all ages and all backgrounds made those roads that were closed well used. And they, of course, helped those people to avoid congestion in those areas and to maintain physical distancing on the trails that otherwise can become congested. And I will just say that it is subject to this entire program to continuous and continuing reassessment at all times. But what we're trying to do here is to take a city that is emerging from a pandemic and ensure that people in a healthy, safe way can get into outdoor spaces and can do so in a way that is ensuring that all citizens have the opportunity to do so and that people aren't operating in an unsafe or unhealthy kind of environment. Transportation staff and Toronto Police worked quickly last weekend, as I'm sure they will do this coming weekend, to address hotspots or flaws that exist in this new arrangement as we unveil it. We're also working hard to get the message out more effectively through the media so that people will know well in advance what the situation is with these roads and these other public spaces. We're working to open up our public spaces where it makes sense, based on the advice of our public health and transportational professionals, so that people have the space to be active and to get around, and at the same time, very importantly, so that they can maintain their physical distance. Chief Pegg.
Thank you, Mayor Tory, and good afternoon. All aspects of EOC operations are continuing, and our teams are doing an extraordinary job of ensuring that critical and essential city services are being provided without interruption. Our PPE inventories remain stable this week, and our PPE management and conservation efforts are ongoing. As Mayor Tory spoke of, I'm pleased to advise that we are continuing to expand the ActiveTO program. Overall, the feedback we've received about the ActiveTO program and the associated closures has been very positive to date. Please note that this upcoming weekend, there will be a number of major road closures that will be in effect from Saturday, May 23rd at 6 a.m. until Sunday, May 24th at 11 p.m. The major road closures are as follows. The eastbound lanes of Lakeshore Boulevard will be closed to vehicular traffic from Windermere Avenue to Stadium Road. The eastbound Gardner Expressway off-ramp to Lakeshore Boulevard, which is exit number 146, will also be closed. The eastbound lanes of Lakeshore Boulevard will be closed to vehicular traffic from Coxwell Avenue to Q Beach Avenue, which is just south of Woodbine Avenue. Bayview Avenue will be closed to vehicular traffic from Mill Street to Rosedale Valley Road, and River Street will also be closed to vehicular traffic from Gerrard Street East to Bayview Avenue. The city will actively manage traffic during these major closures through signal timing adjustments on adjacent routes, as well as by deploying additional roadway signage to alert drivers. Motorists who would normally travel these roads on weekends should plan alternate routes. Those residents who plan to access the closed roads for cycling or walking should access these areas by bike or as a pedestrian, since nearby parking is very limited and no on-site parking is provided. When finalizing ActiveTO major road closures, special consideration is given to mitigating the impacts of planned construction on traffic flow. In addition to major road closures, ActiveTO is also working on the Quiet Streets initiative. Quiet streets are identified neighborhood roads in numerous areas around the city where the roadways are configured for both pedestrian and local vehicle traffic use. City staff continue to work with local councillors and communities to install and plan for suitable quiet street installations. The Quiet Streets initiative makes it easier for local residents to be outside, to get exercise, and to move about the neighborhood while maintaining increased physical distancing. Yesterday, retail stores that have a separate street front entrance were permitted to reopen or to expand their curbside pickup service delivery model. The reopening of these businesses is an important part of Toronto's phased restart. Our EOC and Office of Rebuild and Recovery teams, along with each of our divisions, agencies, and partners, continue to work proactively to support the reopening and expansion of services. Each of our restart plans focuses on complying with the advice, guidance, and direction of our public health professionals in all that we do. These initiatives include the continued rollout of additional CurbTO, pedestrian and curbside pickup zones, in a number of areas around the city. The CurbTO program helps business owners and operators manage physical distancing outside their location, while supporting the increased demand for curbside pickup service. In closing, I remind everyone that toronto.ca/COVID-19 is the best source for up-to-date information on COVID-19 in Toronto. And for more information on ActiveTO initiatives, including a detailed listing of upcoming road closures, we encourage you to visit toronto.ca/ActiveTO. Thank you.
Thank you, Chief. Before we go to questions on the line from staff, we have Janie Romoff from Parks, Forestry and Recreation, Marianne Bedard from Shelter Support and Housing, and Paul Raftis from Senior Services and Long-Term Care. First question is to Albert Delitala from Global News. Albert?
Hi. We heard today that many parking lots at parks will reopen. Why not open all parks? We've heard all parking lots. We've heard reports of some crowding of people having to walk into the parks. Why not open them all? And I guess this could go to Mayor Tory.
Well, we have to take into account the differing circumstances of each of the places that are involved. So I'll give you an example. At Bluffers Park, for example, by having the parking lot remain open, you encourage more people to drive down there, and we've been in a situation where we have hundreds of cars that go there, and it just leads to a sort of chaotic situation that is not in the interest of either public order or public health. And so we're doing it on a case-by-case basis. We had them closed originally because we didn't want people to go to the parks. Frankly, we wanted them to stay home. Now we're saying it's okay for people to go to parks. We'd prefer, on balance, that they would take public transit there or cycle or walk. So we're being pragmatic about this and opening parking lots on a case-by-case basis based on what we believe will be safe and what we believe will be in the best interest of public health.
Okay. That does it for me. Thank you.
Okay, Albert, thank you. Go now to Mark McAllister from City News. Mark?
Mayor Tory, once again, there was city staff out on the streets today. A number of homeless encampments were approached. The people that are living there were asked to move on. Some tents were removed. If you could, this is obviously, I guess it's second time in the course of a week that this has happened. Could you explain further what exactly is happening versus what has been happening in the past in terms of clearing these spaces out?
Well, I'm going to ask Marianne Bedard to comment on that, but I want to make a brief comment first. I believe that the city is following a sensitive, sensible, and consistent policy with respect to, and I think you'll hear the numbers with respect to the activities that went on today, with respect to ensuring that all, if possible, and certainly the vast, vast majority of people who are living in these encampments, which represent a serious public safety and public health risk, are found optional, additional or alternate housing for themselves before the encampments are cleared, and they're cleared after that is done. And I think that is entirely the appropriate thing for the city to be doing in the best interest of public health and public safety. And on that note, perhaps I'll ask Ms. Bedard to address the particular incidents that took place today.
Go ahead, Marianne.
Thank you, Mark, for the question. Yes, there was activity at 2 sites today. It is important to note, though, that these sites, we didn't turn up unexpectedly. We have been working with people staying at these sites for a number of months, and we have been working with them on the plans to move them into housing today. So we worked with some encampments on Power Street. We actually moved 28 people there into interim housing, and one person requested a particular shelter of their choice, and so we assisted with transportation to that site. We also returned to Lakeshore today to continue clearing debris from a site where we moved people from last week. When we arrived there, we did find that there were some new tents. Those tents were not interfered with. We cleared out the debris from previous tenants, increasing the health and safety of the current people at that site. And our Streets to Homes people are now interacting with those clients, determining what their needs are in order to create a pathway for them also to come into indoor space options where people would have access to washrooms and showers and food and medical support. And I think that that's the important piece here, is that we want to make sure that people have increased opportunities for inside placements where it is better for their health and safety to be than living outside. We're creating environments that are physically distanced. Any space that we offer people will be physically distanced, and frankly will be a much better environment for people from a health and safety perspective than remaining in encampments. So these were planned moves. The clients were aware that we were coming, and 28 people are now in their own apartments this evening. So I think that that's quite a happy result from the immense amount of effort that went into those encampments today.
Thank you both. Another question to you, Mayor Tory. On behalf of a colleague of mine, warmer weather typically means a rise in gun violence in our city. So how concerned are you about this as restrictions start to ease as well? Is the city police prepared to deal with the rise in gun violence at this point and a potential second wave of infection, perhaps?
I'm deeply concerned about the current prevalence and continuing prevalence of gun violence in the city and those who have been victimized by it. And I don't just include those who have been victimized directly, but also the upset that it causes in a number of our neighborhoods. I had a meeting with the police chief yesterday to discuss what we were doing and what we might be doing going forward, as well as with the deputy chief and a number of other people. And I will be working with him to make sure that we have the resources that we need to have plans in place, as I believe we do now, but to enhance those plans to make sure that we can fight this violence as best we can, regardless of the weather and regardless of what's going on with the pandemic. The violence is a problem in and of itself. We have some exciting new programs that are in the midst right now of rolling themselves out to help on the community side of this. And we had some ideas yesterday with respect to keeping offenders at bay. And so we will be proceeding with those, and the city will certainly be providing the police service with the support it needs to make sure we try our best to minimize the gun violence in the city.
Okay, thank you. We'll now go to Derek Dionarain from the CBC. Derek?
Thanks, Brad. This first question is for Mayor Tory. How much does the layout of Toronto, with so many people in condos and a lack of backyards, play into your decision to reopen these parks? I know in cities like suburbs in Mississauga, are they at an advantage in being able to keep these parks closed because they have more open space?
I think that if you look back now at some of the history and you look at some of the places where we've made these spaces available, they are instances where the previous generations of city governments have not done the job they might have done in making sure that people who lived in smaller condominiums and apartments in high-rise buildings had an adequate amount of public space. In fact, you can simply do the calculations and see that a lot of areas of dense development have, in some cases, unfortunately, the lowest available parkland and open space per resident of any area in the city. And so I think these are the areas where we've gone, and areas where people tend to congest, both because they live there and because places like the waterfront are attractive. So what we're doing is now, especially in the later stages of this pandemic, where physically distancing ourselves is still very important, making additional public space available, and roadways are part of public space. And so I think we're doing it in a sensible way. We're doing it in a way that doesn't just pick locations out of some playbook that was pulled off a shelf, but rather says, where do we really need to do this to particularly accommodate the needs of people who live in high-rise buildings and in dense communities. And so we're watching it every day. I think the response last weekend was phenomenal. I was at both ends of it, east and west, and just saw an awful lot of happy people from every background you could conceive of, and that was powerful evidence of the fact that we have something going here that people will use, and we just have to keep looking at it in a sensible way and in a continuous way to make sure that we do it right.
Great, and just to follow up, this question is for Dr. Davila, and it may be ground that you've already touched on, but why isn't public health specifically suggesting making masks mandatory on places like transit or in stores if they're so key in stopping the spread of this virus?
So I think at this stage of the game, and you've heard that we've had to adapt our approach over time, right? At the beginning of the pandemic, we were really focused on making sure that people stay home, as that was the best advice to offer from a public health perspective and the best way to protect the health and safety of the residents of this city. As we are starting to reopen, it continues to be the case that maintaining physical distancing and practicing good hygiene, staying home when you're sick or you're supposed to be self-isolating, washing your hands, covering your cough and sneeze, all the advice that we give out with respect to cold and flu season and how best to keep your germs to yourself, these continue to be the mainstay of best practice when it comes to protecting oneself from COVID-19. So at this point, there are only some circumstances, sometimes where that physical distancing cannot be maintained. Those are the occasions on which we're recommending that a mask or face covering, a non-medical mask, of course, for the public, can be used in order to protect others from your germs. We will continue to monitor the situation and, of course, adapt our advice on an as-needed basis. The science is still evolving. I've talked a little bit about that. We are still understanding a lot about this virus, a virus only discovered in January. We are appreciating more and more in the scientific community that there is asymptomatic transmission, hence the change in our advice at this stage. As we continue to learn, our advice may then change in accordance with our evolving understanding of the virus. So I think, stay tuned. We are continuing to monitor the circumstances, monitor the science, and we will continue to provide advice with the best available evidence.
Okay, thank you. We'll go to Brian Passafume now from the Toronto Sun. Brian?
Hi, good afternoon. First question is for the mayor. Today, the ATU issued a statement about comments they say you made on CP24 today, suggesting that the city's transit union has been uncooperative with the city. They counted that they've been more than flexible and you haven't been given the whole story by TTC management. How do you respond to that?
I would just say that I trust that the TTC management, with whom I've met many times and who I ask a multitude of questions to, have given me, I think, a fair accounting of the story. And the facts are the facts. When we sought cooperation from them on a number of things, including doing some much-needed repairs that could be done in times of lower traffic, lower passenger counts, as opposed to having closures on weekends going forward, the answer was no, we just couldn't accommodate that. And I think that would have been a good thing for the city, would have been a good thing for their members to do that work, would have been a good thing for us to get that work done. That's one example of several that I could cite where there just didn't seem to be the willingness to really sit down and really make a deal on that kind of thing that would have been good for the city at a time like this. And I very much regret that. But as I said in those comments earlier on, everybody has their job to do. I understand the union president has his job to do. I'm not sure if the members of the union had known all of what was available in terms of different opportunities for them to do various things and have various arrangements made for them. They would have concurred in the position taken by their leadership, but that often happens. It happens with all kinds of people in elected positions. So, you know, we move on, and our objective is going to be to provide safe, healthy, transit service to people, and that has many, many complications to it. But I will also say this, our operators, the transit operators that have been driving the buses and the subway trains and the streetcars have done an excellent job for us. They've had great courage in doing their jobs, and I want to thank them for that. And I know that some of the positions taken were not necessarily positions by any means that they would have adopted had they been given the chance to do so.
Second question, I just want to go back to your comments you said earlier about men refusing to wear masks because they're seen as signs of weakness. Can you explain where that came from and where you've been seeing this?
I've actually heard people talk about it, and that this is, you know, sometimes an explanation as to why men in particular, more so than, and there are lots of people, I suppose, who don't like to wear face coverings for a variety of reasons. But the bottom line is there are some men who have been concerned about that. And to me, it is a sign of strength and a sign of resolve to fight this virus, to protect your fellow citizens and your friends and your neighbors and anybody else you come into contact with in circumstances where you can't stay far apart from people. I'm not saying it's the major factor or a major factor in why people do or do not wear masks. It's certainly one that has been discussed.
Okay, thank you. We go to Matt Bingley now from Global News. Matt?
Hi, good afternoon. My question is just in regards to the opening of all these amenities. We still haven't seen the effects of just how successful we're being with what's opening this week. And I'm just wondering what considerations you've had to make sure that we're not just sort of throwing the doors open far too quickly here.
Well, I'll speak first just on the subject of the phasing of this, and then Dr. Davila can address, if she wishes, the public health aspects of this. I think you'll note that what we have done here is simply respond to, in many cases, the lifting of provincial orders that had things closed. In some cases, we had duplicate orders also keeping them closed. But we've also gone about it, if you look at the timetable, starting with the dog parks and working their way through other things that won't open for another week or 10 days, to space this out. And that isn't just a logistical consideration to space it out because there are hundreds of these different kinds of amenities across the city, but it is also out of consideration for the public health numbers, which, as we've said, you know, are improving but are still not where we need them to be in the end. So I think that we're trying to adopt a sensible, public health-driven approach to this, but that is nonetheless pragmatic in the context of acknowledging that the provincial rules are changing, that we want to make sure there's consistent practice, and what we've really said is we're going to focus our attentions a great deal on the time when we approach stage 2 and make sure that the numbers justify the additional openings contemplated by that stage as opposed to these ones, which are not unimportant but are of more modest consequence in terms of allowing people to engage in different kinds of outside activities.
So yes, from a public health perspective, if I can add to that, as I mentioned in my remarks, we are constantly assessing our data in respect of what's happening from a COVID-19 perspective in our city. And when we look at our data right now to understand what's happening locally, we are still seeing that our community cases are declining, albeit slowly, but declining just the same. So we will continue to monitor that so that we can inform decisions around reopening, armed and equipped with this data.
And on the matter of the fields, obviously there's soccer, baseball. You're allowed to play, to my understanding, with a team as long as they are living within your own household. How exactly do you enforce that? Are you expecting, the honor system here, or are you thinking that you might actually see bylaw officers checking in on people?
For good or for bad, I'm a lawyer, and when it came time to read the rules with respect to soccer fields and who could use them and when and who had to live together and how many people and whether they were on a team or a family, it was and remains a source of great confusion for us, to be honest. I think what we're really saying to people is that they're open for very casual use by people. They are not permitted to be used for organized sports of any kind, and that we do have to rely on people's common sense, personal responsibility, and good graces in the context of when they show up and somebody else is using it, and physical distancing. So, you know, I have confidence in the people of Toronto that they can figure this out more easily perhaps than I or other people can figure out the labyrinth of rules that have been put in place that govern this. Everybody's trying to be careful, and I think the people of Toronto will be careful as well.
Okay, final question. On her final day at News Talk 1010 is the always fair Siobhan Morris. Go ahead, Siobhan.
She's already left.
She left? Oh, Siobhan.
Just kidding, Brad.
All right, well, good luck to you, Siobhan. That concludes
wishes.
today's presser. We'll be back here on Friday, May 22nd at 3:45. Thanks, everybody.